and yet the vaccine manufacturers have no liability. That's a recipe for corporate malfeasance. And of course, the vaccine manufacturers, the pharmaceutical industry, has been convicted many, many times of criminal activity. Are they ever sent to jail? No, they get fined. They get fined and they get slapped on the wrist, and then they go back to business, basically brainwashing Americans into thinking that the solution to their problems is drugs that don't actually fix their medical issues.
How appalling is this mandate issued by this unelected official in Virginia? What information does he have to justify what he's saying?
I mean, I'm sure that he would say that he was speaking in the event of a vaccine that worked and was safe and effective, and he's also speaking from a place where he thinks that COVID-19 is extremely deadly and that it is really the pandemic of the century. And quite frankly, I think that the data just doesn't support him in those assertions. I mean, this pandemic is not, I wouldn't call it a pandemic. It's a problem. It's a disease. People are sick. People are dying. I have friends in New York City. I have friends in New Jersey who worked through the COVID-19 pandemic at the peak of it, who saw the sickest patients, who had lots of patients on ventilators. They were very clear with me that something happened, something is going on. But, I work in rural America, and I've seen 3 cases in 8 months, and one of them was a false positive. So you're going to tell me everybody ought to be vaccinated over a virus that seems to be harming a very, very small proportion of Americans, most of whom were already extremely old or malnourished or extremely sick? That doesn't hold water.
And you, did you say you trained at UVA?
I did. I went to University of Virginia School of Medicine. Graduated in 2014.
And where do you practice now?
I practice down in Colonial Heights, Virginia at Andrews Wellness Consulting.
What's your message right now to not just Virginians, but to the American people?
They need to wake up to the fact that the mainstream media is not telling them the truth about their health, because the reality is that the mainstream media works for the people who pay their salaries, and that's the top advertisers. And you can go through the list of the top advertisers on any mainstream media network, and you will see that they are producing things that either make you sick or treat the sicknesses that you have. Why would anyone who's got that agenda tell you how to be healthy?
Right. Very good. And just as an aside, what about hydroxychloroquine? What's your thoughts on that?
So I have no personal experience using hydroxychloroquine because I've seen no cases of COVID in which I had an opportunity to prescribe it. I have dear colleagues who are very exceptional, I would say exceptional physicians. One of the best doctors I know I'm thinking of right now was on the Ingram Angle when hydroxychloroquine came out, and he said he was in contact with many doctors in New York City who were using it and thought it worked. Yeah. And unfortunately, it's